Hi everyone, my name is Orit and I'm the program lead here at Women's Health and Women's Hands Community Health Center located in Toronto, Ontario. I am the program lead for the National HIV Prevention Strategy for African, Caribbean, and Black folks in Canada. Through this project, I've been able to work with a tremendous group of hardworking, talented, dedicated, and passionate set of peers, coordinators, and outreach workers, which has made me feel so grateful and so proud. Over the last year, we've been busy distributing HIV self test kits, as well as providing HIV prevention techniques and technologies all across Canada, targeting marginalized communities, more specifically African, Caribbean, and Black communities. Whether we've been attending larger events such as Afrofest or Pride, smaller events within the community, attending universities or colleges, we've been able to successfully distribute hundreds of thousands of HIV self test kits. Now, just to provide you all with a snippet of how successful we've been, I would like to provide some numbers for you all. So, starting off in Alberta, our folks over in HIV Edmonton are sitting at 970 HIV self-test kits distributed. Ribbon Rouge has been able to distribute over 1,000 HIV self-test kits. And finally, 150 HIV self-test kits have been distributed by SafeLink Alberta. Moving on to Ontario, we have Women's Health and Women's Hands Community Health Center sitting at 3,500 HIV self-test kits distributed. Africans in Partnership Against AIDS are sitting at 810 HIV self-test kits distributed. And finally, Black Coalition for AIDS Prevention have been able to move 455 HIV self-test kits. It is important to note that these are just a few organizations that I've named, and there are many, many more organizations across Canada that have been just as successful. We are excited to continue all of our efforts in the coming months and to continue educating our community.
Hello, this is SafeLink Alberta. This year for the World AIDS Day, which is celebrated under the theme Let Communities Lead, we would like to emphasize the importance of testing and precisely self-testing.
The HIV self-test is a safe and reliable way to test yourself for HIV. It means you can get your own test, do the test yourself, and get your results right away. Like a home pregnancy test, you don't have to go to a clinic or doctor's office to get tested. In our programs here in Canada, we use Insti HIV self-test.
The Insti HIV self-test is adapted from the Insti HIV-1, HIV-2 antibody test for personal use. This is one of the most accurate third-generation tests available with superior sensitivity to recent infection. When used by health professionals, the test's sensitivity and specificity were both calculated to be 99.8%.
This test is for screening antibodies, and if it comes back positive, a confirmatory antigen test still needs to be conducted for confirmation of HIV positive status.
The self-test kit offers individuals a discreet way to access the test, allowing them to discover their status with utmost confidentiality and privacy as crucial elements. Users can go through the testing process without compromising the security of their personal information, ensuring a confidential experience from start to finish.
Picture Sarah, a working individual with a busy schedule, showing concern for her well-being but feeling cautious about conventional testing environments. She chooses a confidential health check, the HIV self-testing kit. Following straightforward instructions and benefiting from privacy measures, she conducts the test in the comfort of her home, acquiring meaningful health insights directly and discreetly. This example underscores how self-test kits address individuals' privacy apprehensions when delving into personal health matters.
Greetings to all of you, my fellow brothers and sisters, African, Black, Caribbean people here in Canada and our extended members in this land of Canada. My name is Emmanuel Ndianabo Lambert. I do work here at the Africans Partnership Against AIDS as the African Caribbean Black Heterosexual Men's Connect to Care Coordinator. I'm happy to invite you to this celebrations of World AIDS Day. We are happy to be part of this HIV movement and the journey together in our community here in Canada. We work closely with people that are coming from Africa, especially the African Caribbean Black community, and my program engages post-heterosexual men into activities and programs that bring HIV care, HIV work, and HIV light into this nation. We are also happy to inform you that throughout this year, we have received funding from the Ministry of Public Health Agencies of Canada and other agencies, public sponsors, that government sponsors that help sponsor the work that we do. I'm also part of the HIV Prevention Strategy Alliance with our coordinator audit at Women's Health and other members from other provinces in Canada, that we have been able to engage African Black Caribbean people and trying to address stigma, HIV, SBBIs, and other preventive strategies that we are using to help people. And we have been giving out HIV self-testing kits, and this year we have been able to hand out over 810 HIV self-testing kits and prevention measures to our at-risk populations, but also most importantly, engaging our members of people living with HIV, African Black people here in Canada who are newly diagnosed and those who are new to Canada into the work that we do. I'm happy to inform you that we also have a number of programs, including the support program, the prevention program, the volunteer program, the administrative program, the heterosexual men's program, that all these programs help create the work, inform, brings together people that we serve and create meaningful opportunities for people living with HIV at Africans Partnership Against AIDS. Finally, I want to wish you the very best, and as we celebrate together as an HIV movement, as we reach out to souls and people that are gathered with us this World AIDS Day, December 1st, may we all be blessed and continue to thank you for your support at Africans Partnership Against AIDS and other organizations that are coming together to do this work. May we all be blessed by God. Thank you very much.
My name is Michelle Muchetu, and I am a social worker at the Ribbon Rouge Foundation. At the Ribbon Rouge Foundation, we acknowledge the diversity of the African, Caribbean, and Black communities. That is why we use a trauma-informed and intersectionality lens in order to address these diverse needs of our communities.
Hi everyone, my name is Chantal Mukandoli. I'm the one of peer engagement ambassador, distributor of HIV self-testing at Women Health in a Women Health Community Center. Since 28 years living with HIV, I decided to show my face to advocate for people living with HIV, for people living and affect with HIV without discrimination of race, age, language, religion, education, culture, color of skin, gender, and sexual orientation. I understand the importance of adherence of HIV treatment and the prevention. As we celebrate AIDS World Day, I am more determined to continue to work toward fighting HIV prevalence. Part of my leadership, this is to educate and teach the community about HIV prevention strategy, such as how to use HIV self-testing kit.
At HIV Edmonton, our mission extends beyond healthcare. It's about community. We believe in involving our community deeply in our work. Their engagement is crucial for effective HIV prevention and support. From volunteering to education, every action taken by our community members plays a pivotal role. Education is empowerment. By spreading knowledge about HIV prevention, we're equipping our community members with the tools to make a difference. The global theme of ending HIV epidemic resonates with our work. We strive to create a world where HIV is no longer a threat to health and well-being. Together, with the unwavering support of our community, we're making strides towards a healthier Edmonton free from HIV.
Hello everyone, my name is Nonti and I am the Research and Outreach Coordinator at Women's Health in Women's Hands Community Health Center, and I currently work with the team that does the HIV self-test kit distribution. And as we celebrate World AIDS Day 2023, we wanted to reflect back on our journey as a team. When we started off with this initiative, we were doing kit distribution through the center. So anybody that wanted a kit could only access it by coming to the center. And we recognized the gaps that came with that strategy. And so we decided to engage peers who were already involved in work within the community or who were community members. And so we decided to create a group, the peer navigators, and this consists of a team of 3. And this team comes with members that are invested in making sure that the initiative is a success. So they all come with their unique attributes. They focus on different demographics. We have some that focus on students, some that focus on community event, community spaces, community leaders, community organizations, all these different strategies that they have all individually came up with that work for them and that also work for our initiative. And because of the strategy, we've been able to distribute quite a number of kits. The numbers will be shared and you'll be able to know that we are definitely doing the work out there in the community. This strategy has worked for us. We are one of the top leading teams in terms of kit distribution, and we pride ourselves on the work we're doing in the community and the fact that the community continues to embrace and work with us. This is a strategy that we believe will work in any environment as long as we continue to engage with one another and work collaboratively. So as we celebrate World AIDS Day, I want to implore you as a community to find an initiative that works for you, an initiative that can help us as we fight against HIV. Thank you.
You can obtain supplies by going with or without an appointment to community organizations across Canada, such as Safe Lake Alberta, HIV Edmonton, Women's Health in Women's Hands, Ribbon Rouge, and many other organizations, and at numerous booth events or by contacting a social worker.